In a typical handstand, the body starts in a standing position, facing forward, with the arms by each side and the feet shoulder width apart, planted on the ground. In this video, we start in a right leg lunge. We will be focusing on the muscle movements of the right leg. The left leg muscle movements are in opposition to the right leg. Step 1. Right leg lunge. Shoulders move through the sagittal plane to flexion.
Shoulder flexion. Prime mover, anterior deltoid, upper pectoralis major, and biceps. Antagonist, latissimus dorsi and posterior deltoid. Synergist, deltoid anterior fibers, pectoralis major upper fibers, biceps brachii, and coracobrachialis.
The elbows are fully extended. Elbow extension. Prime mover, triceps. Antagonist, brachialis, biceps brachii, brachioradialis. Synergist, aconius. Fixator, muscles of the shoulder, scapula, and sternoclavicular joint.
Hips are in extension. Hip extension. Prime mover, psoas. Antagonist, gluteus maximus, biceps femoris, semitendinosus, semimembranosus, posterior head of adductor magnus.
Synergist, iliacus, tensor fasciae lati, rectus femoris, anterior adductors, especially pectineus, sartorius. Fixator, intrinsic stabilization subsystem, rectus abdominis, obliques, quadratus lumborum, and erector spinae.
Right knees in flexion. Knee flexion. Prime mover. Biceps femoris, semimembranosus, semitendinosus. Synergist. Popliteus, gastrocnemius, gracilis, sartorius. Antagonist. Quadriceps, vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. The ankle is in neutral position at 90 degrees.
Step 2. Shoulders remain extended but move through the sagittal plane straight out in front. Elbows are still extended and the hands are pronated and the hips remain in flexion.
The right knee is now extended. Knee extension. Prime mover. Quadriceps, vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. Antagonist. Biceps femoris, semimembranosus, semitendinosus, popliteus, gastrocnemius, gracilis, sartorius.
Synergists. There are no true synergists of knee extension. However, the gluteus maximus and soleus could be viewed as synergists to knee extension during closed chain mechanics. Fixator. All muscles of the ankle, hip, and LPHC, especially the intrinsic stabilization subsystem, the glute complex, and the inverters of the ankle. Right ankle is in plantar flexion. Plantar flexion. Prime mover, soleus, and the gastrocnemius. Antagonist, tibialis anterior, extensor digitorum longus, extensor hallucis longus, and the peroneus tertius. Synergists, fibularis longus, fibularis brevis, posterior tibialis, flexor hallucis longus, flexor digitorum longus, and the plantaris. Fixators, medial and lateral stabilizers of the knee, quadriceps, and the musculature of the foot.
Step 3. In this step, the right leg is kicking up to meet the left leg. Shoulders are extended at an angle, and the right knee is now extended, kicking up through the sagittal plane to meet the left.
Step 4. The handstand. Shoulders are in extension above your head, knees and hips are extended, and the feet are pointed in plantar flexion.
Step 5. The shoulders, elbows, and knees are extended, while the hips are now in flexion.
Step 6. Returning to the right leg lunge. Shoulders move through the sagittal plane back to flexion. Elbows and hips are extended while the knee is back in flexion, landing back in a right leg lunge.